So why is a harm reduction approach necessary?
Well, I think, if we look back historically, a harm reduction approach was introduced as a way of mitigating harms. So, trying to reduce harms. And it was introduced, as early back as the 50s, when, physicians in the UK were deciding to prescribe alternatives to the illicit drug market. And so we have a long history of, introducing interventions. And it was really in the 1980s that harm reduction got kind of popularized. And that was particularly to prevent the risk of transmission of HIV.
Hmm.
And the introduction of, clean supplies and needle exchange really took hold, supervised injecting services being introduced, all to really prevent the harms of drug use. And, that's continuing to expand during the overdose crisis with the introduction of naloxone distribution. And now we've got many calls for safer supply. And, the safer supply really points to the need for decriminalization as well as regulation of the toxic drug supply. So I've really given you kind of a whole scope of kind of why harm reduction is important to preventing harms. But I want to give you one other kind of perspective why harm reduction is important. Um, it's particularly important in the context of very criminalized use because it provides a way of taking a non-judgmental, non-stigmatizing approach that acknowledges and accepts people where they're at. And I've done a lot of research in harm reduction, and one of the things we don't talk about enough is the importance of that trust and relationships as a foundational piece of harm reduction that can really help to connect people to other services. And some of that happens through those interventions that we were just talking about, like needle exchange, supervised injection sites, because people are able to come and not be judged for their drug use, but helped. And so I think we need to remember part of the importance of harm reduction is preventing a very broad range of harms from overdoses to HIV to stigma and discrimination as well through a set of interventions and establishing safe, trusting relationships.
Hmm. Very important. Hmm.
Mm-hmm.
Hmm.
It's kind of the core of so much of
Yeah,
what we do in nursing.
it is. It is.
Yeah.
Yeah, we have our the core one of the cores of our nursing program is relational practice, and something that
Mm-hmm.
we spend a lot of time trying to get our nurses to understand, our nursing students to understand. Hmm.
And we focus on relational practice as well, and there's a lot of good, I think, values and principles, but at the same time we have to make sure that people understand how criminalized drug use is, and that's the context that they're working in, and they're going to be influenced by prohibition. We've all been influenced by prohibition since we, long before we came to work in the health or the harm reduction field, right? And we've been taught that these things, like there's a historical and ongoing legacy of criminalization that's there, and that's why decriminalization is important. It's not the solution. It's not going to make a safer drug supply, but it is going to help destigmatize um, drug use and enhance, I think, the potential for access to
Hmm.
services.
Hmm. Hmm. For sure.